All right. So first of all, we know that typically when we're working with children on the spectrum, there is divergence from typical milestones. So this graph here, brought to you by the Autism Community in Action, looks at the prevalence rate. So if we look around to between 2004, 2006, that's when I started grad school. Newsflash, I am old, very old here. So when I was in graduate school, we had the prevalence rate of 1 in 125. So now we are in 1 in 36. With all of that increase, I think we've gotten a lot better at identifying some of the early flags as to maybe on the pathway to a diagnosis. So on the left-hand side, this does come from the CDC. There's some early signs and symptoms of autism, possible red flags. Again, this does not mean there's a diagnosis, but maybe we should be talking to our pediatrician. So we're not responding to our name by 12 months. We're not pointing at objects or showing interest in 14 months. We don't have any kind of pretend play skills. We're avoiding eye contact and want to be alone. We have trouble understanding other people's feelings or talking about their feelings. We have delayed speech and language skills. We're repeating words, engaging in echolalia. We give unrelated answers to questions. We get really upset by minor changes to our routines. We have obsessive interests. We have repetitive behaviors and unusual reactions to the way things sound, taste, smell, look, or feel. And on the right here, there's a developmental chart for those really early months from 0 to 3, 3 to 6, and 6 to 9. And at this time is when parents are doing lots of pediatrician appointments, right? We're doing vaccines, we're doing wellness checks. We do those really frequently early on because kids develop so rapidly. The CDC is a really good resource for parents and for practitioners looking at developmental milestones. So you can see here, they do break it down, especially in the early months, by only a handful of months in between, and then it goes by years. You're going to see in a couple of screens what that looks like if we were to put them all in one grid, which I have done for you. But the milestone tracker is a really good resource for parents. If you have kids on your caseload right now that have younger siblings, maybe like very young siblings, infant, year old, year and a half, if parents are talking to you about like, hey, I have some concerns about little brother, little sister. We are obviously not diagnosticians, or most of us are not. These are some good resources to send back to parents. Say, hey, there's this free tracker. Maybe you want to start using it. So when you have your next wellness checkup with your pediatrician, here you can come, go with data, right? It has some really neat videos via YouTube to say, hey, this is what I mean by, do they repeat a sound or action to get attention? This is what we mean by handing you a book. This is what happens when a caregiver leaves the room. They have all these little short video snippets, which I think are really helpful for parents to accurately answer these types of questions. So instructions, also if you go to Autism Speaks, you can go to get the MChat. Again, this is for kiddos who are 16 to 30 months of age. So this is another resource to give to caregivers to be able to bring them to this website. It's also available in multiple languages as well. So if English is not their first language or preferred language, it is in a whole bunch of them now. I don't have the total number off the top of my head, but I know it's in quite a few of them. Again, another place you can direct caregivers if they're concerned about another sibling, or like, hey, my niece or nephew, now that I know this, I'm also concerned about them. This is a great resource to bring to them as well. Oops. There we go. Just a note, screening does not supplant diagnostics, right? So screening, just because the screening tool comes back with a concern does not mean that there is an automatic diagnosis of autism. We just want to make sure that we are giving parents tools if they're concerned, but we are certainly not telling them, yes, younger sibling does or does not have autism. That is something they need to go and work with a healthcare professional on. All right, but early implications here is that early diagnostics can lead to early intervention. And we know the sooner that we start, the better. However, even though we can get reliable diagnostics done by age 2, we're still seeing that most kiddos are not being diagnosed until age 4 or later. And so ideally, we are getting all this information into the hands of caregivers as soon as possible. So if there is concern, we can start intervening right away and not have to wait. Things have gotten better, but I think it's important for everyone to realize that there has been a lot of barriers to access to care, especially for children of color. So this is from 2011, so this is a while ago, but I think so important to see as kiddos grow up, looking at our history as a field. We do see that socioeconomic factors such as parental education, race, and maternal immigrant status all influence the age of diagnosis. Socioeconomic status was a stronger predictor than even the severity of symptoms expression at the point of diagnosis. So even if we had a kid who maybe would have scored at level 3, that still didn't take precedent over socioeconomic status on the diagnostic pathway. So keeping that in mind, another study here, this is from 2014. So now this is 10 years old, but still, we are seeing that Latino children are receiving a diagnosis of autism 2.5 years later than white non-Latino children. And when they are diagnosed, they are more likely to have severe symptoms than non-Latino children. So this was a huge barrier 10 years ago. We are seeing this improve, but some of the barriers include access to care due to poverty, limited English proficiency, lack of awareness or advocacy, and the diagnostic process was really confusing to caregivers. Or it was really inconvenient. Maybe it was really hard travel to get to someone who provided those services. It was also really unpleasant for the child, so we might be more reluctant to bring them in for that appointment. This was another study done looking between cases between 1993 and 1999 that Caucasian children received the autism diagnosis at 6.5 years, while African-American children did not receive the diagnosis until 7.9 years. After adjusting for age, sex, and time eligible for services, African-American children required more time in treatment before receiving the diagnosis as well. So we're seeing some racial disparities here in our diagnostic process. Also, just across both populations here, really late, right? 6.5 years when we can do a accurate diagnostic at 2. That's 4 years that we would not like to see wasted, right? But we do have some recent progress. This is just one study conducted in 2022. So we are seeing now that we are seeing a lot more equality across racial and ethnic groups. So looking at all of those groups between 4.4 and 4.9 years across Asian children, white children, Black children, and Hispanic children, which is great that we're seeing some equality there, but we're still over 4 years old. So we still have a ways to go to be able to make sure that we are getting kiddos younger if possible. All right, we still also have some work to do. I'm looking at this article here from 2023. We're seeing that autism prevalence, looking at assigned sex at birth, that we are seeing an issue. We're not getting female clients diagnosed as soon as their male counterparts. We are missing them, and they're being diagnosed a lot later, oftentimes. So we still have work to do. Like I said, I think it's getting better than it was 10 years ago, but we still have work within our field. All right, so again, I mentioned already clinical implications of early recognition and diagnosis. Intervention started at an earlier age does seem to yield better outcomes. The Individual with a Disability Act specifies that starting at the age of 3, children with disabilities are eligible through the public education system for special education related services. So even if they are also trying to get access to ABA services in home or in center, they still would also qualify for services within their public school district, which is important, especially for those who may not have commercial insurance. Maybe Medicaid providers are, few and far between. They would still qualify for their public school system as well. And then parents can also get access to resources and support. All right.